My name is Dr. Andrew Elliott. I'm a foot and ankle surgeon here at the Hospital for Special Surgery. I commonly treat conditions of the foot and ankle, inclusive of things such as bunions or hallux valgus, arthritis of any of the joints in the foot and ankle, tendon issues, whether that be Achilles tendon ruptures or chronic tendon issues, both with posterior tibial tendon, peroneal tendons. My approach to patient care is patient-focused. I really want to go ahead and listen to their concerns, listen to what their problem is, and then really tailor something for that patient specifically. Not every patient needs an injection, not every patient needs surgery, and that's sort of the art of medicine, is trying to figure out what's the best course, even though it's the same problem in different patients. I think the importance of patient education is paramount. The patient can only put their trust in you if they understand what you're going to do to them as well as for them. And so I tend to use models, we use pamphlets, we use handouts, we use web-based products in order for patients to really get an understanding of what we're doing and why we're doing it. I think success in treating a patient is different for every patient. Ultimately, this is why we all went into medicine, is to really help people. And so to have somebody tell you at the end of their treatment or at the end of the course that they've just gone through that you have really helped them is something that's very satisfying, to be able to be part of that and to give that person that they couldn't get themselves.